Good morning, my dear fans. I am Dr. Basil Cheka SMON, the MD of Madonna Medical Center in Sinweke, Itoboma. In my course of writing as an author, having written several medical books, and have a YouTube channel where I teach on various aspects that troubles our health, as well as various aspects that has to do with our how to live a good life, how to enjoy good health, how to enhance our healthy living, and the rest of it. Several people have asked questions. What are those diseases or ailments that can give rise to erectile dysfunction, other than traumas or injuries, maybe trauma such as a spinal cord injury, spine issues, and maybe loss of lumbar lordosis, loss of vertebral functions, especially the lumbosacral vertebral within the lower spine, L1, L2, L3. So, but physiologically, what are those diseases that can be able to, mitigate against erection or prevent a man from getting an adequate erection for enjoyable coition or intercourse? Basically, there is only just three physiological ailments, just three, that can be able to disallow a man from enjoying a full coition. Uh, these are one, hypertension; two, diabetes; and then three, hyperlipidemia, which we know as cholesterol. So hypertension, diabetes, as well as hyperlipidemia. Now, there is a consistent pattern in these three ailments, and that is the major aspect through which they disrupt, or will I say, prevent full erection during coition, even if there is adequate foreplay, or even if the couple involved are in maximum sexual euphoria. This pattern is to disrupt blood flow, or to block or prevent blood flow to the seminal vesicles. So these are the issue. Like for example, now in the case of hypertension, by the time there is elevation of arterial wall pressure, which we recognize as the elevation of blood pressure or high BP, as we commonly term it, you will see that the arteries will, get compacted. There will be narrowing of the arteries, thereby reducing the flow of oxygenated blood, especially to vital areas like the pelvic cavity, which can ensure that the spongy tissues of the penis gets fully engorged with blood, thereby ensuring erection. Because without the spongy tissues filling up with blood, there won't be any form of erection. So in this case, hypertension narrows the arteries, thereby preventing such free flow of oxygenated blood in order to enhance the erection through filling up of the spongy tissues. In the case of diabetes too, there is what you call plaques. Plaques are built within the arterial walls, especially when the sugar has become consistently too high, and it has been untreated for a long period of time. So there is what we call the buildup of plaques within the walls, arterial walls, that will block or prevent the free flow of blood. Apart from even the issue of filling up the spongy tissues, the person also stands the risk of developing what we call peripheral artery disease, but that would be a subject for another day. So, whereby blood is not reaching essential areas within the organs or the system in the body, thereby depriving them of oxygenated blood. And in such a case, there will be what we call necrosis, that is the death of tissues lining within those organs. So now, like I said, that's a separate teaching for another day, which we'll dwell on. Now, when these plaques are built up within the arterial walls, it also prevents blood from flowing through the spongy tissues that builds up as a catalyst to make the penis to be turgid and erect. Now, also in lipid cholesterol, that's hyperlipidemia, also the same pattern is seen building plaques, because when the cholesterol level becomes too high, fats are deposited within the arterial walls, which in turn becomes plaques, that is built up of fats, thereby blocking the arterial walls from ensuring that there is free flow of oxygenated blood. So these are the phenomenon or the process through which these three diseases can be able to give rise to loss of erectile dysfunction, because when the arteries that transmit blood to the spongy tissues of the penis becomes blocked with plaques and fatty deposits, I don't know how it's possible for the penis to get erect, because the process has been disrupted. You understand? So, in our next lecture, we are going to dwell on what we can be able to do to keep these diseases at bay, as well as also what we can be able to do to enhance our lifestyle. Because in every of my teaching, I've always made it known that the major key treatment factor is prevention. Prevention, whatever that will give rise to any issue, try to avoid it. That's why even the Oyibo people said prevention is better than cure. So in our next class, we are going to dwell about how we can be able to control these diseases for someone who already has it, how we can be able to prevent it from occurring for those who don't have it, and then how we can be able to enhance our healthy lifestyle, more especially for our men, because in my clinic, several men are coming every day buying sex enhancement drugs when these things could be solved naturally. Sex enhancement drugs are not the answer, or is not the answer to loss of erection or erectile dysfunction. It's just a short means to an end, a sort of what will I say? That is a shortcut, or a kind of a temporal remedy which cannot stand the test of time. So we are going to analyze step by step what we do to be able to prevent these diseases from occurring. And bear in mind that these three diseases that I mentioned, or I've been able to give a little insight on, that is hypertension, diabetes, and lipid cholesterol, if they are at a higher peak or a higher level, sex enhancement drugs may not work. It may not work because there is already a situation at hand. You understand? It's just like when you have malaria and you are taking paracetamol. Ordinary paracetamol is an antipyretic and a mild analgesic medication. Now, if you are having fever because of that malaria infection, the Plasmodium falciparum issue, definitely, when you take paracetamol, the fever will reduce, but the parasite has not been eliminated until you take a good anti-malaria drug. That is when you get yourself totally and overall. You understand? So if you only depend on paracetamol, the fever will come and go, and you will still have the symptoms of the malaria, which is chills, loss of strength, and the rest of them. until you take an adequate anti-malaria medication that will be able to take care of it totally, at least within that period of time. The same also goes with cases like this until the root of the cause of that erectile dysfunction is addressed. The use of sex enhancement drugs such as sildenafil, Cialis, and the rest of them are just a short temporal phase. So next time we are going to analyze all these things properly, like I said, find out what we can do for those who already have it to be able to enjoy cohesion very well, and those who don't have it, how to be able to procedures that we can instill for future prevention. Thank you and God bless you.